Monkeypox was first discovered in 1958 when outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name, monkeypox. The first human case was recorded in the Democratic Republic of the Congo, DRC, in 1970, during a period when the world was nearing the eradication of smallpox. The disease primarily affected children in remote areas, with sporadic cases reported over the following decades. Initially, Mpox was restricted to Central and Western Africa, particularly in countries like DRC, Nigeria, and the Central African Republic. In the current year, Mpox has witnessed an unexpected uptick in reported cases across several regions. This resurgence is particularly notable in areas previously considered low risk. Two epidemiologists have identified several contributory factors, including viral mutations, increased human encroachment into wildlife habitats, and lapses in vaccination coverage. The heterogeneity of case distribution highlights the complex interplay of these elements, necessitating a multifaceted approach to containment and prevention. Transmission and spread. The monkeypox virus is transmitted to humans through close contact with an infected animal, human, or contaminated materials. Primary transmission often occurs through direct contact with blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Rodents, particularly rope squirrels, tree squirrels, and Gambian pouched rats, are considered major reservoirs of the virus. Secondary transmission, or human-to-human spread, occurs through respiratory droplets, direct contact with lesions, and possibly via fomites. Notably, the virus's transmission potential has led to multiple outbreaks beyond Africa, often linked to imported animals or international travel. The 2003 outbreak in the United States, caused by imported Gambian rats that infected prairie dogs, highlighted the risk of international spread and the need for global vigilance. Symptoms and clinical presentation. Monkeypox presents with symptoms similar to those of smallpox but generally less severe. After an incubation period of 6 to 13 days, the disease typically begins with a febrile prodrome, including fever, intense headache, lymphadenopathy, back pain, myalgia, and asthenia. The characteristic rash appears 1 to 3 days after the fever onset, often starting on the face before spreading to other parts of the body. Lesions progress through 4 stages: macular, papular, vesicular, and pustular, before crusting and falling off. Severe cases, though rare, can lead to complications such as secondary infections, bronchopneumonia, sepsis, encephalitis, and corneal infection with subsequent loss of vision. The case fatality ratio varies widely but is generally between 1% and 10%, with higher rates among children and individuals with compromised immune systems. Diagnosis and laboratory confirmation. Diagnosing monkeypox involves a combination of clinical examination and laboratory testing. Given the similarity of Mpox to other rash illnesses like chickenpox, measles, and bacterial skin infections, laboratory confirmation is essential. Polymerase chain reaction (PCR) testing is the preferred laboratory test due to its accuracy and sensitivity. Samples are typically collected from skin lesions, preferably the fluid from vesicles and pustules, or dry crusts. Additionally, serological tests and antigen detection methods can be used to confirm the diagnosis, although they are less specific than PCR. In regions where monkeypox is not endemic, it is crucial to maintain a high index of suspicion, especially in individuals with a history of travel to endemic areas or contact with imported animals. Prevention and control measures. Preventing the spread of Mpox requires a multifaceted approach that includes surveillance, vaccination, and public health education. Vaccination with the smallpox vaccine has been shown to provide cross-protection against monkeypox, as both viruses are closely related. The development of the newer, third-generation vaccines, such as the modified Vaccinia Ankara (MVA) vaccine, offers a safer alternative, particularly for immunocompromised individuals. Public health strategies also focus on limiting human-animal interactions in endemic areas, educating communities about the risks of handling sick animals, and ensuring proper isolation and care of infected patients. Contact tracing and ring vaccination, vaccinating the contacts of confirmed cases, have proven effective in containing outbreaks. Global impact and recent outbreaks. The global impact of monkeypox has grown significantly in recent years, with the virus being reported in countries outside Africa with increasing frequency. Notably, the 2022 outbreak in multiple non-endemic countries marked a turning point in the global understanding of Mpox as a public health threat. The outbreak, characterized by clusters of cases among men who have sex with men, raised concerns about the potential for sustained human-to-human transmission outside traditional endemic zones. The World Health Organization, WHO, declared the 2022 outbreak a public health emergency of international concern, PHEIC, underscoring the need for a coordinated international response. This declaration prompted increased surveillance, research, and collaboration among nations to mitigate the spread of the virus. Treatment and future challenges. Currently, there is no specific treatment approved for monkeypox, though antiviral agents like tecovirimat and cidofovir have shown efficacy against orthopox viruses in laboratory settings. Supportive care remains the cornerstone of treatment, focusing on alleviating symptoms, preventing complications, and managing secondary bacterial infections. The global shortage of specific antivirals and the challenges in their distribution highlight the need for continued research and investment in therapeutics. Looking forward, the future challenges in combating Mpox include the potential for the virus to establish itself in new ecological niches, the risk of more severe outbreaks, and the ongoing issue of vaccine access in low-resource settings. Additionally, the emergence of antiviral resistance and the virus's ability to evolve pose significant concerns that require ongoing monitoring and research. Monkeypox, once considered a rare and geographically confined disease, has now emerged as a global public health challenge. Its history, from the initial discovery to recent international outbreaks, underscores the dynamic nature of infectious diseases in an interconnected world. As Mpox re-emerges as a public health concern in 2024, it is imperative that healthcare professionals, policymakers, and the public remain vigilant. Ongoing research into the virus's epidemiology, pathogenesis, and transmission dynamics will be essential in shaping effective interventions and safeguarding global health.